What would you tell patients about telehealth? Is this an option? Is this something that they have to do? Are there different options in terms of a hybrid model of treatment?
Yes, there is. And so some of the patients that I have seen are doing telehealth exclusively. And so how that would work is we do the evaluation, come up with some instructions, answer questions, give exercises, and then perhaps they will work on those at home once or twice, and then we'll schedule a follow-up visit. And that has worked very nicely. Other patients that I'm seeing are using a combination of both, where we do what we can virtually, and then perhaps we both agree that, well, it would be helpful to meet in the clinic briefly to answer questions or clear a couple things up, or for me to do a little hands-on examination or treatment. And so, during this time with the pandemic, there are lots of different situations out there. And so some of our patients are very high risk because of age or other health conditions. And so they are really seeking ways to not have to be out and about with people, whether it's running errands or medical appointments. So this gives them a lot of flexibility. Others of our patients are stay-at-home parents with kids, and they're helping kids with school and maybe trying themselves to work from home. And so scheduling an out-of-home visit during the day is very difficult. And so we can give them flexibility for scheduling these types of visits later in the afternoon, or perhaps even the early evening or weekend. And then lastly, there are those that maybe they themselves are not high risk, but they're living with someone who is, and so they don't want to bring the virus home. And so this gives them a chance to get their needs addressed with telehealth, with physical therapy, but not put a family member at risk.
Well, and even if a patient does need to come into the clinic, there are ways that there are things that you're doing to mitigate that risk, right? With certain distancing procedures and being flexible with timing, correct?
Absolutely. And so for those folks who are at high risk or live with someone who's high risk, we can work with them to find a time where maybe our clinic isn't as busy for them to come in for that one-on-one visit. And of course, our clinic has taken all the necessary precautions with, keeping our folks safe.